I was a resident here at Memorial Health University Medical Center Children's Hospital of Savannah. And when I completed my residency, and even before then, halfway through, I knew that I wanted to stay. There was such a community feeling here, and there was also just such a relationship that I built with my patients. Our patients are a very diverse population. They come from miles and miles around. I have patients that come from 4 hours away who I met during residency who still want me to be their pediatrician.
I think that when people come here, when they experience what it's like here, you realize that there is a much more collegial atmosphere than you would expect at any other workplace. People like each other here. The physicians like to work with each other. The physicians are happy to be here, and they want to work and they want to teach. And that is the most important part of having a residency, is we want you to experience pediatrics in an environment that's fun, in an environment that's nurturing, in an environment where you can learn the best.
So we have 24 residents, that's 8 per year. We have over 45 attendings, and that affords us the ability to have really close relationships with between the residents and the attendings, to form close bonds, to form meaningful mentorships. We also are a program that does not have any fellows, so the communication that we have between the residents and the attendings is unfiltered. And that's one of the things that I really love about the program, that I think allows our residents to thrive.
Having direct access to an attending and their thought process, and being able to ask questions in the moment and receive a direct answer, I think that's really important, because it helps provide you with the type of knowledge that you think and that you identify as being important for your field of care.
So as a resident here, I was able to grow with graduated autonomy, because we don't have fellows and we have a smaller program. I was able to have one-on-one time with my subspecialist. So from my subspecialist, I was able to learn how to manage hypertension and murmurs and things of that nature without always having to rely on a referral, because I've received one-on-one training right from the subspecialist.
So the Children's Hospital of Savannah is the only freestanding children's hospital in Southeast Georgia. We serve a catchment area of over 46 counties in South Carolina and Georgia, from the South Carolina line all the way to the Florida line. And so that allows for a large patient population that comes to the hospital. We have a 50-bed unit with 14 PICU beds, as well as 36 med-surg beds, and a 94-bed NICU that allows for us to care for level 3 NICU patients that come from any of the areas.
What I love about our children's hospital is that the size provides a culture of care and comfort, and so we were fortunate enough to have this beautiful newer building, but it was created with patients and families in mind. So the rooms are larger, so there's more comfortable settings for the patients who have to have long-term stays because of their chemo or their chronic medical conditions. There are beds for families to sit in and recliners. There's also a playground and a garden, so people can take a break from just the hospital walls. And then we have our lovely child life specialists who come and make life as normal as possible within the hospital. Everyone works together as a team, and that feeling is what our patients express back to me. Every time I'm on call, there's at least one patient who's saying, "I'm so glad I came here today. This is where I want to be for my care."
Here at Savannah Children's Hospital, we have the benefit of having a large amount of pediatric-specific subspecialists, ranging from pediatric surgery, pediatric neurosurgery, and multiple others. And one of the benefits in particular is that they're here in-house and easily accessible.
Currently on staff, we have nephrology, as well as GI services, adolescent medicine services, cardiology, neurology, ENT, our pediatric surgeons, our pediatric neurosurgeons, who can all provide care that outside of this area would be unavailable without the Children's Hospital.
It's great for continuity of care throughout our community. It keeps our patients here in our hospital without having to send them far away. But also, as a trainee, it's excellent because you're able to see and participate in the care of very, very sick and diverse patient populations. And I think that really benefits the education and the fundamental knowledge that you get as a resident here.
I think a resident who joins our program, first and foremost, wants to be an excellent physician who is compassionate and capable. And the residents who we attract are interested in forming close relationships, both with their patients and also with the staff and the faculty, and with each other.
one of the biggest resources that we can provide and that we are happy to provide and we love to provide is personality. Our hospital, our attendings, our staff, we are all very much dedicated to residency training and just knowledge and training in general. So I think that environment and that personality and that culture of just acceptance and patience and just friendliness is one of the biggest benefits to our program.
Our nurses love getting to know our new residents and making sure to build those relationships with them. They work really hard to set up time to make sure the residents feel supported. Whenever we have social events, we like to invite the residents to come so they get to do things with our nursing staff outside of the hospital, because I know a lot of them moved to Savannah. It's a new place. We want to make sure they feel welcomed in the community and not just at work too.
This is a wonderful place to train, but also a wonderful place to live. When you walk out of the doors of the hospital, you want to be in a position where you're not struggling to get home, where you're not in traffic, where if you need to decompress, that you're gonna easily find a place to go, easily be able to meet with your friends, easily be able to go to the beach, which is 25 minutes away.
Savannah is clearly an area where it is hard to not like it. The temperature, the weather, the community, it's such an inviting area. It's got so much history and has grown so much over the last 18 years that I have been here to allow for you to have experience that's unlike other things. You are on the coast, you are near the water.
Savannah is very close to cruise ports, Hilton Head, Tybee, so there's always something to do. When I'm looking for residents to come join our program, I'm looking for individuals who have a hard work ethic, who are trustworthy, but really love children and caring for families. I think that's super important because at the end of the day, residency is hard. That's normal. That's how you learn. But at the end of residency, the goal is to be an expert in whatever field you choose. So I think the most important things to look for in a resident are that continuous, can-do attitude, but also that compassionate outlook on patient care.
I love my job, quite honestly, because the work that we do here, it feels impactful.
I would tell someone to come here because they matter, because the people who come here want to make an impact in the lives of their patients and in the lives of the people around them. And this is a place where you can make a difference and you can feel it. You can see it on the faces of the people that you deal with, that you're helping every day. And if you're the type of person who thrives from helping people, from making people's lives better, then this is the place for you.